One thing that's very important for us is that we continue to be on the forefront in managing all types of spinal problems, whether they be the simplest problems or the most complex problems. One of the reasons we have such great outcomes at HSS is that we are very particular with how we assess patients and treat them from beginning to end. It's a matter of understanding what exactly is causing the problem, getting the most accurate diagnosis, and once we get that precise diagnosis, then we do the best surgery that we can in the safest way to get the best outcome.
Spine problems are common in society. Up to 80% of people end up having some type of low back pain over the course of their lives. It's one of the things that we're sort of vulnerable to for a variety of reasons. Some of those reasons include the jobs we do, the sports we play, our genetic makeup, and also injuries that occur. Sometimes we do have problems that are the consequences of infections or tumors.
The great majority of patients do not need surgical intervention for their musculoskeletal problems, 90 or 95%. So it's really important as an institution like HSS, which is the best musculoskeletal center in the world, to be able to provide that level of musculoskeletal care across an entire spectrum. So everything from the simplest problem that really doesn't need a whole lot of intervention to non-operative care, to preoperative care, to operative care, and then postoperative care, and then really getting the patient back into their movements and activities. Physiatry at HSS is really a kind of one of the key elements of the entire institution. As a musculoskeletal center of excellence in kind of every aspect, physiatrists see patients with all levels of musculoskeletal injuries. And we're able to do an evaluation of it and then look at really what are the non-operative options for patients. And that may be therapy, that may be injections, that may be modification of what they're doing right now, that may be medication. So how do we provide people with all those non-operative options for their musculoskeletal care?
Pain management divided roughly into inpatient and outpatient pain management. On the inpatient side, we have a team of doctors, nurses, and nurse practitioners who care for patients who have had surgery, and some of them are people who have complex pain situations that are recognized prior to evaluation, and we take care of those patients while they're in the hospital. On the outpatient side, we have a group of doctors who are seeing patients who have different kinds of chronic pain issues, some acute pain issues. Many of them are people who have spinal problems. We tend to see patients who have anything from very complex situations such as post-laminectomy syndrome. We see patients who have had nerve injuries, people who have conditions where their primary care doctor has not been able to help them, or they have routine issues such as sciatica or neck pain. We see those patients for evaluation and for planning treatment for the next stage of their management.
So patients requiring surgeries of any kind, very, very complicated or much more commonplace or simple, benefit from the expertise of surgeons that do these operations over and over and over in an institution that has a systemic approach and is a center of excellence. I think that HSS has great success in the outcomes of spine surgeries for a variety of reasons. I think, first of all, we have an excellent team of non-surgical and surgical experts who help us get patients through their care from start to finish. We have a very deliberate path of indicating patients for surgery, finding the least invasive and the least destructive surgery that we can do to give them the best possible outcome. Our goal is to decompress nerves that are being squeezed, realign spine that is out of position, stabilize the spine that may be unstable. And by achieving those three sort of maxims of spine surgery, the outcomes are more successful.